Hey everyone, I just wanted to shoot this really quick video to teach you a little bit about the disc. What is the spinal disc? How does it work? Why do we have them? How do they get hurt? How can we get better? Okay, so the spinal disc is a super specialized structure. It turns our kind of very strong kind of spinal column into a very flexible, dynamic area of our body as well too, while maintaining its ability to protect our spinal cord and all the nerves that stem from it. So how cool is that? It turns us from being a steel rod into a very dynamic and flexible and capable human being. And the human spine is this so unique and so powerful compared to all other spines in the world. And one of those things that gives us that ability is our spinal disc. And so let's learn a little bit more. Well, the disc is really a specialized ligament. So ligaments attach bone to bone and they kind of control how that joint moves. And so a joint moves through the actual bony structure, how it's designed, and then the ligaments restrict that range of motion within safe kind of planes. And so because the spine can do virtually all planes of motion, it needs a really specialized ligament. And so it gets the spinal disc, which is totally unique. There's no other spot like it in the body. And so what it is a bunch of layers of ligaments. So you kind of see this cross section over here, and you see all these rings, like the tree rings of like a tree. All of these layers are ligaments oriented in different planes, and so those fibers can restrict different types of motion. And then so we have this really tough annular ring, okay, and this annular fibrosis, and then it's surrounded or kind of encapsulating the nucleus pulpopus, okay? And then in the bone, we got bone on top, bone on bone, bone on the bottom, and then we have this really dense piece of bone called the end plate, okay? And so we're going to learn a little bit more about why that's important in a second. And so just to show you how those different oriented fibers work, they can resist compression from gravity and kind of jumping up and down. It kind of keeps that jelly in the middle because this is a super highly pressurized sac. It's actually maintaining your body weight. So you got to think like we have all of these kind of jelly things underneath, kind of the shock absorbers. And so they have to be super, super strong. And so they do that with a lot of pressure. Okay. And that pressure wants to escape when we bend and move and twist. And the nucleus pulpopus is the center of motion of the motor units of the spine. So you got two bones, and they are going to articulate around the very center of that disc, okay, in an ideal situation. When there's injury happens, that shifts and causes wear and tear, which we can explain later. But the different oriented fibers resist and compress to kind of keep that jelly in the middle. When we get compressed fibers, that's when they're weaker. The fibers are designed to be stretched. That's when they're stronger, okay? And so shear forces are pretty challenging on the spine because we're kind of buckling and stretching them at the same time. And so that's one of the ones that can lead to injury. And then twisting. Twisting creates a lot of buckling, and that can create an injury called delamination, which I'll show a picture of in a little bit. And so this is that delamination picture. So this is a view from the top. Okay, so we have that ring and we got that jelly in the middle. And so when we bend and move and twist and we do multiple planes of motion at once, the fibers are kind of buckling against each other. And so we can start to get weakness in them because they're designed to be really tight, but when they start to get buckled like this, they're weak. And if they get too much like this, they'll call it delamination. They'll go, and just like they'll pop a little bit. And that's the pop you do not want to hear come on your back. The story where I bent over in the morning, I twisted a little bit, and I heard a pop in my back and it really hurt. That's where you tore fibers in your disc and you delaminated layers. Okay. Why that's a problem is as these delaminations kind of progress, and they will progress because once happens, you get delamination, you get inflammation, which we'll show in another picture, and you get a bunch of chemicals that actually start to weaken the disc. And then typically the disc and the joint are going to get stuck and fixated and subluxated. And so they're not going to stop circulating nutrition. All of this leads to weakening of the fibers and further delamination. And that delamination will allow that jelly to start to escape and push through kind of via these pictures. You kind of see how it starts to push through, and then it can actually start to fully herniate and get out of the disc. Okay. And so those are the pops we don't want to hear. Okay. And so how that causes breakdown is in a healthy disc, we have this end plate right here, and there's really only blood flow around the outside layer and right at the tip where it kind of meets the bone right here. Outside of that, this plate is so thick, it doesn't really allow a lot of nutrient transfer. So the blood vessels all stop right there. Okay. And so with a healthy joint and it's moving, we get nutrition to the outside of the disc, but because the joint is moving, it can pull nutrition to the nucleus pulposus and throughout the annular fibrosis through a process called osmosis. And so that just means that kind of water or water-like materials with solvents can start to move around within and get to all of the living tissue and to feed it and to keep it healthy. And also it lets it pull away waste, okay? Because this is highly pressurized, we can't have ingrowth of vessels and nerves because there's so much pressure, they can't fight that pressure gradient. Okay, so now what happens with degeneration is we get that delamination process, and that allows the disc to expand and bulge, which allows pressure to fall. And then typically this is going to be also with a joint fixation, so that bone's going to become stuck and subluxated. And so it's not going to get that nutrient transfer throughout the disc. All of these things lead to a process called degenerative disc disease. Now, degenerative discs are more prone to delaminations and bulges because overall the structure is weaker. If the spine gets in like a whiplash, it's more likely to get hurt. If you slip and fall, it's more likely to get hurt. And then the kind of double whammy of this is you get this blood flow kind of growing in, and that's the body just trying to feed nutrition to these areas because it's not getting that nutrition. So the body's trying to compensate with it. So you get this ingrowth, but as you get this ingrowth, the nerves grow with it too, and they're going to be touching kind of injuries for the first time in your life. And so this is the person that says, I literally did nothing, and all of a sudden my back is killing me. That's because your nerves just touched an injury that's 15 years old. Okay. And then also this material has never been exposed to your blood system before, and it's totally encapsulated. And so your body actually treats it as foreign. Okay. And that induces inflammation. That induces actually a cleanup process by your body. And that's going to lead to stiffening, inflammation, and pain as well, too. And that's your body just trying to clean up these old injuries. Okay. And then you get all these chemical releases cause calcifications, and that turns into bony arthritis. And so what we got to do is we got to get these joints moving with adjustments, and then we got to make up for lost time with traction. That's where we're going to create traction in the spine, and that starts to pull nutrition in, and it kind of freezes and stops this process from continuing. What does this look like on an MRI? Well, we should have some healthy fluid in the middle of the disc, and that's going to show up white on this image. And you can kind of see all of these discs are showing white, and then you can kind of see these ones down here, they're showing up black. That's called desiccation. That's just a fancy word for death. And so these discs are starting to die because they were starved of nutrition for so long. Okay, so we don't want to see this. On your x-rays, we're going to see this as disc thinning. Okay, this is how it starts. This is a 15-year-old. Okay, 10% of 10-year-olds, another study besides this one found 10% of 10-year-olds, this was 300 kids done in Scotland. They just MRI'd pain-free 10-year-olds. And they found that 10% of them already had like the very beginning start processes of degenerative disc at L4 and L5 primarily. And so in this case, this is a 15-year-old healthy and then starting to break down. Okay, you can start to see the bulge right there. Use is usually started, actually this was slightly bulged back here as well too. This is usually started by minor traumas over time, and then that was left unaddressed, kind of compound and start to break down. And so this is what it looks like in kind of a more adult spine, and this is how it affects the body. So first we have the healthy disc, okay, showing lots of white, okay, and then we have a cross section down here, and we show that so that we can look at the bulge. And so step one, this disc got a bulge in it, and you kind of see it starting to come back right there. Right here, it's starting to push backwards into that nerve, okay? And then now we want to start to look at the muscles. So now we've left it. We've not taken care of it the way we should, okay? And that bulge is just going to worsen with time and an accelerated rate. And so you see healthy disc starting to darken, back to healthy. And then we look at this view, starting to see some bulge. But then look at the muscle. So this muscle should be dark over here, like this. When you cut off a nerve supply to a muscle, it will weaken. And that leads to a process called fatty infiltration. And that's exactly what it sounds like. It's fat is evading the muscle, and it gets weaker and weaker and less functional. And so not only is this disc more predisposed to injury, it's also weakening the muscles that in turn protect it. And so now the back is just less able to even withstand forces. And so this leads to acceleration. This is why we have to address injuries very, very quickly. We've seen in our office this process beginning in 15-year-old athletes that hurt their back, okay? And so now degeneration continues. Bulge gets bigger, hits more nerve pressure, more fat into the muscle. And then essentially now all kinds of fat in the muscle. This is becoming more and more non-functional, and the disc is really, really broad and kind of compressing multiple nerves. And so you don't want to end up with this. And so any injuries you got, you want to treat very quickly. And sometimes, often these injuries will only hurt for a couple days if they hurt at all. So this is why we love checking kids, and we just love checking the spine. Just like we check our teeth, we need to be checking our spine, because once the problem's too far progressed, there's only so much correction we can do. And so we want to see you do well for not only now, but well into the future. So I look forward to serving you at your next visit. If you have any friends or family member, you want to get them checked out. If they're a friend or family, an existing patient, we're going to take care of them. We're on mission to help as many people as we can. And so just bring them with you on your next appointment, or tell them mention your name when they come in. Looking forward to serving you next time.